Hello, as I'll introduce, my name is Steve Morgan, and I've been studying pharmaceutical policies for nearly 30 years. I really believe that this conversation we're having tonight is very important because national pharmacare systems can provide universal access to appropriately prescribed, affordably priced, and equitably financed medicines. Indeed, they do so in every high-income country with universal healthcare, because every such country integrates prescription drug coverage and management into their universal healthcare system. Well, every such country with the exception of Canada, that is. Despite all of our pride in Canadian Medicare, it is uniquely incomplete insofar as it effectively ends as soon as a patient is handed a prescription to fill. Our current pharmacare system in Canada is not a system at all. It is an incomplete and uncoordinated patchwork of drug plans. This patchwork consists of over 100 different public drug plans. These vary significantly across provinces and across the patient groups that they target. Our patchwork also includes tens of thousands of independently financed and independently managed private drug plans for the roughly 2/3 of Canadian workers who are lucky enough to have such coverage through their workplace. The coverage offered through this patchwork of private and public plans is hardly uniform, and it is certainly not universal. Nearly 1 in 4 Canadians is uninsured for prescriptions or underinsured for the medications they need. This often occurs because when Canadians are lucky enough to have coverage, their drug plans require them to pay hundreds or even thousands of dollars per year out of pocket. Inadequate prescription coverage affects Canadians in all provinces, at all income levels, and with all kinds of health needs. This results in well-documented barriers to necessary care across Canada. Indeed, it is estimated that more than 2 million Canadians are skipping prescriptions because they cannot afford the out-of-pocket costs. That results in worse health outcomes for patients and higher costs elsewhere in our healthcare system. It would be far better for our health and for our healthcare system just to provide universal, comprehensive public coverage of necessary medicines, just like we cover medical and hospital care in Canada. It turns out that doing so would also be cheaper. You see, Canada's patchwork of independently financed and managed drug plans is not only terribly inefficient to administer, it also fragments our purchasing power on the world market for pharmaceuticals. Research has shown that single-payer pharmacare systems, like the ones found in Australia, New Zealand, Norway, Sweden, and the United Kingdom, use their purchasing power to obtain the best drug prices in the world. Now, presently, the prices of prescription drugs in Canada are among the highest in the world. But if we implemented a truly universal pharmacare system, it would be one of the biggest bulk purchasers of medicines on earth. And as anyone who shops at Costco knows, prices fall when you buy in bulk. And it's not just me who's saying this. The Parliamentary Budget Officer and the Department of Finance have both estimated that the purchasing power of a national pharmacare program would be so significant that a comprehensive public pharmacare plan for all Canadians would actually cost us $4 billion a year less than we are currently paying for medications through our patchwork of private and public drug plans. Now, I want you to remember that. A comprehensive public pharmacare system built just like Canadian Medicare will save us billions of dollars per year while improving access to medicines from coast to coast to coast. National pharmacare can also ensure that the best available evidence guides all of our decisions concerning drug coverage, drug pricing, and prescribing and utilization. This is why 5 separate national commissions have recommended that medically necessary prescription drugs be integrated into the Canadian Medicare system. This is also why it is just so important that the federal government fulfill its promise to implement national pharmacare without further delay. A principled and evidence-based pharmacare system for all Canadians will immediately improve healthcare across this country. It will save lives, and it will save billions of dollars every year. The only real obstacle to getting this done is the opposition of industries who profit from the status quo. And that is why conversations like this one we are having today are just so important. These conversations mobilize people, and in so doing, they generate the political will that is necessary for government to do the right thing for Canadians, even in the face of industry opposition. So thank you. Thank you for listening and for being part of this conversation.